Hello, I'm Instructor Howard, and this is our Breaking Down Coding Cases quick tutorial for our BC 2020 course. What I have here are some general CPT coding rules, and what I'm going to do is kind of give a brief, quick, simple tutorial on how to locate your codes, and that's what this is, and also how to understand your surgery coding section. It may seem like it's a bit daunting, but it's really fun and it's really easy to do coding and to learn coding. Okay, so number one, we will locate our main term inside of the index, and the main term is what is being done and where. So when you see a line of information that needs to be coded, the first thing you ask yourself is what and then where, and that's kind of what you highlight. That's one of the first things you highlight. So then you will locate any additional subterms, possibly indented underneath the main term in the index. For instance, we'll have a main word such as destruction, that's your main term, and any other subterms, for instance, skin, and that would be your subterm. So it's what and where, but then there may be a specific type, and you'll find that as well when you code, and we may have some examples today to go over. Okay, so go to the index in the back of the book, match up your search terms as closely as possible. Step 3, verify the code or code range in the CPT section or subsection. You know, a code range is a range of codes. It could be anywhere from 2 to maybe 10 or 15 codes that are in a range that's basically similar, or the procedures are similar to one another. And then what we would do is, verifying is cross-referencing it. So verifying is checking that code inside of the main area, usually the surgery section, but it could be the radiology section or the lab section, depending on what you're coding. All right, and then step 4, pay close attention to alterations in variables, with versus without, and versus or, etc. So that's important as well, because there may be one CPT code that has all of the services provided without fluoroscopic guidance, and then there may be another code, the exact same procedure, on the next page that includes fluoroscopic guidance. So that's the difference between choosing an accurate code or choosing an incorrect code. Okay, and then what we would do is choose your code and any related modifiers if needed. Now we know modifiers pretty much um, will not modify the procedure completely, but it modifies it slightly. For instance, a bilateral procedure. If our CPT code does not include a description for bilaterally, then what we would do is use modifier 50 to explain that the provider rendered the services on both sides of the body. Okay, here's an example. We have our main term here, destruction, and we have 4.0 centimeters of a malignant lesion of the eyelid. So all of these words in red are specifically searchable in the index. Well, we would ask ourselves what, which is destruction, number one, and the subterm, that it is a lesion. And not only is it a lesion, but it is a lesion on the skin. What I have here in parentheses, and whenever you see me put something in parentheses, that means that it is applied or implied that it's on the skin. And what happens when you're doing integumentary coding or anything that to do with lesions, they are pretty much on the skin unless the description tells you they're elsewhere, for instance, the kidneys or the lungs, then in that case, usually it's called a tumor. In that case, we would go to, you know, lung or kidney or the other body part. But the word skin is not in our scenario. However, it's implied because that's usually the only place that lesions in the integumentary system will be found. So, although this is not in our particular scenario, and I'm backing up just a little bit, it is important because it's usually hard to find the destruction of the lesion if you don't include skin in your search priority when you're in your index for the integumentary system. So you definitely will be looking for skin, and you'll see that if you follow along with me. Okay, and then the type of lesion is malignant. Now we know that we can have benign lesions, which are non-cancerous. We can have malignant lesions, which are cancerous, and we can have pre-malignant lesions, which could possibly become cancerous due to the type or the dynamic of the actual lesion or its behavior. Okay, so here's our code range. When you search your index in this order, 1, 2, and 3, you should be given this code range right here. Now I'm going to do a sidebar note and explain that this is the way that I have decided to choose my search terms and search in the index. There are various ways to locate your codes in the CPT. The simplest way is just to go to the main word or the action word, which is what I call it, and then go to the body part. Sometimes you can go to the word lesion, and then from there you'll be taken around about a different way, but you may still find your code that way. So if you found it differently, or if you ran into a case similar to this and you found it differently, then that's okay. Kudos to you, because that's fine. Okay, so then what I did was I chose the code 17284 because my location, which is the eyelid, was documented inside of the description of this code, and the size. So that's why I have the 4.0 highlighted here in green. It doesn't appear in the index, but when I go through my code range, what happens is I'm given various codes to choose from, and they will change based on whether they are malignant or benign, where they're located on the body, and the size. And the next few slides will kind of explain to you how to determine what you're going to do when you get into coding in your surgery section. Okay, so here we are looking at the information about the surgery section. We know that it is the largest section inside of the CPT manual, and it's formatted in the code ranges beginning from the ones all through to the sixes. And what makes you become a strong coder is when you can pinpoint those ranges and know them by heart. For instance, the ones are the integumentary, the twos, the musculoskeletal, three is respiratory, cardiovascular. So anyhow, it is divided by subspecialties. So like I said here, the ones, the integumentary. So every surgeon has his own specialty or subspecialty. And then what we do is when we work for that particular specialist, we generally code from the same sections of the CPT manual on a daily basis, which we become more and more familiar with that one section or sections that he uses. Okay, so here's some information that I was speaking about earlier. We have notes and guidelines throughout the entire surgery section that helps us determine how we're going to code for a certain scenario, giving us rules, parenthetical notes, which are notes that are written in parentheses. And the information is varied and quite extensive, and it is a must read. You must read this information that you run into to become more and more familiar with your coding. Once you learn those guidelines and understand the notes and how to code specific things, it sticks with you. You're going to kind of know off the top of your head what you need to do when you start coding for instance, the integumentary system. You're going to know that some lesions you have to add up the sizes in order to come into in order to get that one correct code, or you can only code certain wounds based on the depth of the wound and things like that. So the guidelines will help you, as you code. Don't just go to the book, look at a code and choose it. Just get as much information as possible. Okay, so here we have the CPT manual text changes. Basically, what it's telling us is when we see these symbols and all of our symbols that we run into on the pages, the description of the symbols are always located at the very bottom of that particular page or pages that we're on, telling you, giving you kind of a quick tutorial about what this means. So when we see something like this, these particular triangles pointing together, it's telling us that the text has changed from the previous edition. So every year our CPT code book is updated, and so is our ICD-9 manual. So that's what makes coding fun, because every year you get to sharpen up your skills, and it's just a never you never stop learning. Okay, it's a never ending learning experience. So that's what I like about coding. Okay, so here we have subsection notes. It tells us here that subsection notes apply to the entire subsection. So this is the subsection here, musculoskeletal. The section itself is surgery. So you kind of look at your CPT book like a web page. You have your main page and then you have forward slash. So you have surgery forward slash musculoskeletal system. Within the musculoskeletal system, you'll have other specific subcategories or categories and subcategories, and we'll get into that. So as you can see, it's giving us some notes here about casting and strapping and what the definitions are. So this is really important as you begin coding. Go through and review as many notes as you possibly can. Jot down little things to yourself, highlight things, and then begin coding, and you'll see how much easier it becomes over time. Okay, we have our subheading. So we're still in the musculoskeletal system. Wait a minute. We're still in surgery forward slash musculoskeletal system, and then we can go forward slash again. Now we're into our subsection or subheading, the spine. And as you can see, the spine is also known as vertebral column. So here's another good hint and tip to know what your alternate words are for the same body part. So you may have something that shows up in a coding scenario that says something happened to the vertebral column. When you go to the vertebral column in the index, it may reference you to spine and vice versa. Okay, so we have notes in here. Subheading notes apply to the entire subheading. So anything that's related to the spine or the vertebral column these particular rules or instructions or information can apply to any of the codes listed underneath here. And of course, you all probably already are familiar with how the codes appear in the CPT book. Okay, now we have categories. So the category within itself, under the subheading of vertebral column or spine, we have forward slash graphs. So graphs is the next category, and then within this category there are some additional notes that's just specific to graphs. So anything within any notes within the category apply to that entire category. So you may have 5 or 6 codes within graphs underneath graphs that this information right here pertains to. So I'm going to back up just a little bit. Let me see if I can. Maybe not. Let me see. Okay. So, subsection notes. We're under musculoskeletal. All of this information right here applies to the entire musculoskeletal system. Subheading, the spine and vertebral column. So all of these rules right here, or this information right here, applies to anything listed up under the spine. What else is listed up under spine is the category of graphs. So all of these rules apply to the category of graphs. Whatever is inside of graphs, any codes underneath, these particular rules right here apply to that. It's kind of like a pyramid. You think about your coding like a pyramid. Now we have a subcategory. So here's some information about the subcategory. Remember, your section, surgery. In this particular example, the / is digestive system, which is the subsection. So the web page, surgery / digestive system. So it's bringing it all together. Section, subsection, subheading, a category under that subheading, subcategory up under here. So the very first subcategory, because there are multiple subcategories under repair, but in this particular instance, we're under the word hernioplasty or herniorrhaphy and herniotomy. So a hernia, basically, because we're dealing with the digestive system, and a lot of people get hernias in their abdomen. So it's telling us here that it is very important to know medical terminology and anatomy, because it all makes sense. Once you know it, it all comes together. So here we have our other notes that is referencing to the hernia category, which is under repair. So repair, subcategory, notes that apply to here, and this is exactly what the CPT book says. If you turn to this page right now in your CPT manual, you will see that it says the hernia repair codes in this section are categorized primarily by the type of hernia, and as you can see, there are different types: inguinal, femoral, and incisional. So it does not matter. So it's telling us here, when we start coding, if the provider says the patient had a femoral hernia and this and this happened and it was repaired, it's telling us here it doesn't even matter what type of hernia. When we go to code for that, any code that we choose underneath would be applicable for that specific type of hernia. And there you have it. That's why notes are very important. Okay, so we have some additional information that we will run into when we're coding that is specific to that one code. So that's why it's underneath this particular code or codes that's in this particular category. And so it's telling us here, given, and this is what we call parenthetical information. It says, for reconstruction of palate with extraoral tissue, see these codes right here. So basically what it's saying to us is that when we chose this code, or if we're about to choose this code, if something in our description of the procedure that happened today is dealing with reconstruction of a palate with extraoral tissue instead of a resection of a lesion, or a palate or lesion, then you need to go here. And so that's why it's really important to read as you go. Okay, and so what I have here today is, let me make sure I pick the right file, is an example of coding, and let me increase the size here. Okay, so here's an example, and I have 5 random cases from one of our chapters, and what I did was I highlighted the main and search term and solved the first one. So what I'm going to do, as you can see the document here, I'm going to share this week with you guys, and I want you to take what I've shown you today and use this every time you do coding. So here we have number one. It says a physician is placing a nasogastric tube using fluoroscopic guidance. Okay, so what I did here, the main term once again is highlighted in red. Even though he says he is placing, this would be applicable in the index for what and where, and the what is placement. So that's what I would find. And as you can see, I have that in parentheses because it does not actually show in the scenario. Okay, and then where or what, placing what subcategory, nasogastric tube or a tube in the nose that goes down to the stomach. So this is what and where, and what again, tube. And then here's some additional information here that he's using fluoroscopic guidance, and this will come in handy in a little while. Okay, so my code here is CPT code 43752, and this is what we did. Number one, we went again to placement in the index of the CPT manual, page 880. Number two, we searched for the subterm, which is underneath, and you're going to run into a lot of different codes that falls under that term or subterm under placement, but it's and back up a little bit, they're in alphabetical order. So when I go to the ends, I went to find or locate nasogastric tube, and in my CPT we may have different versions of the CPT, but my version of the CPT, I'm on page 880 in the index. And so there I was referenced to review the code 43752. And as you can see, I said review the code, not choose the code, because we never code from the index because that's incorrect coding. And so what I did was I went over in my CPT in my surgery section to page 264 to verify and review the code 43752. What I learned is that this code is definitely a perfect match because it includes all of my terms listed in my original case. So I have nasal or oral gastric, and then I have tube placement, and then here is where I see the words fluoroscopic guidance. So this is what this is what I'm locating here. Even though I didn't find fluoroscopic guidance anywhere in the index under these two words, the full description of the code 43752 is explaining to me that fluoroscopic guidance is included. So what I did here, like I highlighted the important information, and I'm going to send this out probably in our discussion, or I may email this. But coding, and here's a little note here, coding is a lot like math. It has rules, but it's fun and rewarding when your solution is 100% correct. So have fun this week, have fun learning coding, have fun coding, and thank you for viewing.